Ceremonies Committee, Professor Mohamed Duku, the guest lecturer, Professor Iliya Jalo, the CMD, FTH Gombe, Dr. Yusuf Mohamed Abdullahi, other vice-chancellors and leaders of tertiary institutions here in Gombe, the Provost College of Medical Science, Professor Manga Mohammed, wife of the guest lecturer, Iliya Jalo, all deans, directors, HODs, staff of the university, other family members, guests invited, the special guest invited by the guest lecturer, Ambassador Isa Manager, who is here together with us, our father, Mr. Leonard Yakubu, Magajin Garim Tula, the wife of the Mai Tula, members of the general public, members of staff, gentlemen of the press, we welcome you to this 14th inaugural lecture in the series of inaugural lectures of Gombe State University. Distinguished ladies and gentlemen, at this moment, I will quickly invite the chairman of the University Ceremonies Committee, Professor Mohamed Duku, who is also the Dean, Postgraduate School, Gombe State University, to come for the introduction of the event. You're welcome, sir.
The Acting Vice-Chancellor, Professor Sani Ahmed Yauta, other principal officers of the university, visiting Vice-Chancellors, the inaugural Professor Iliya Jalo and his family, members of the Gombe State University Senate, or the Chief Medical Director, Federal Teaching Hospital, Gombe, special guests, distinguished ladies and gentlemen, students, members of the press, good afternoon. Today, we are again here to make history. We will continue to make history with this university continuing the universal tradition of inaugurating its newly appointed or promoted professors into the various disciplines. Today we are here gathered to witness the 14th inaugural lecture, and which I guess is the fourth from the College of Medical Sciences, and I think also the first from the Department of Pediatrics. It is going to be given by a distinguished scholar and physician, Professor Iliya Jalo, on the dilemma of a neonatologist in low resource setting using improvised technologies to enhance newborn survival. So I'm sure we are going to listen attentively to Professor Jalo's works over the decades. He has been working on children, neonates, apparently newly born children, and he's going to tell us a lot. And every time we come here, we learn a lot from these distinguished professors who have been professing in their chosen field of career. So without spending too much of our time, may I invite the Acting Vice-Chancellor to please come and give his opening remarks before we go into the actual business of the day. Mr. Vice-Chancellor.
The Deputy Vice-Chancellor Administration, Gombe State University, the visiting Vice-Chancellors from the neighboring universities, the Chief Medical Director of Federal Teaching Hospital, Gombe, the guest inaugural speaker of today and his family, professors here present, distinguished ladies and gentlemen, good afternoon, and you are welcome to Gombe State University, and you are welcome to the 14th Inaugural Lecture of Gombe State University. Gombe State University, we will continue to make history, and we will continue to make sure that this inaugural lecture delivered by our newly appointed professors continues. I will want to assure you that the management of the university will try as much as we can to see that this lecture continue. Today we are going to listen to Professor Iliya Jalo, who is going to give us his inaugural lecture. He is going to tell us what he has been doing since the time that he was promoted to the rank of a professor in his field of study. And at the end of it all, he is going to profess to us what he has been doing, the challenges, and then the solution he must have proffered for all the problems and challenges that he encountered in his career that he rose to become a professor. So this will continue, as I've said, and we welcome all of you, and we thank you very much for creating time from your busy schedule to attend to this. Thank you very much, and may God bless Gombe State University.
Thank you very much, sirs. At this moment, ladies and gentlemen, I want to invite, at the same time, invite the inaugural lecturer to please rise and come to the stage as I invite Professor Isaac Ediba, the University Orator, to come for the citation of the inaugural lecture.
The Acting Vice-Chancellor of Gombe State University, Professor Sani Ahmed Yauta, the Deputy Vice-Chancellor Administration, Professor Danladi Umar, the University Registrar, Dr. Abubakar Aliyu Bafetu, PhD, the University Librarian, Dr. Henry Maina, the University Bossa, Chief Jefania Shehu, the Chairman of the University Ceremonies Committee, who doubles as the Dean of the School of Postgraduate Studies, Professor Muhammad Guramadku, the Provost, College of Medical Science, GSU, Professor Muhammad Manga, Deans, Directors, and Heads of Academic Departments, other administrative and technical staff of the university, the CMD of the Federal Teaching Hospital Gombe, Dr. Yusuf Muhammad Abdullahi, visiting Vice-Chancellors, representative of the traditional institution from Tula, professors and other members of the University Senate, Dr. Iliya Jalo, the spouse of the inaugural lecturer, and other members of the family, postgraduate and undergraduate students, ladies and gentlemen. I have the singular honor and privilege, with the authorization of the Acting Vice-Chancellor, to render today the citation on Professor Iliya Jalo, the 14th Inaugural Lecturer of Gombe State University. Professor Iliya Jalo was born on the 10th of January 1963 in Bule, Tula, Kaltungo local government of Gombe State. He enrolled initially at Wange and subsequently at Awak primary schools for his primary education. His secondary education commenced immediately afterward at the government secondary school Dadinkowa and was wrapped up at the Science Secondary School Gombe. He then proceeded to the premier university of Northern Nigeria, Ahmed Bello University Zaria, where he underwent the IJMB program and thereafter started a degree in medicine and surgery, MBBS, which he concluded in 1989. After the mandatory NYSC program in Kwara State, he furthered his training through a residency program in pediatrics, culminating in passing the fellowship exam in the year 2000 when he became a consultant. In addition to this, he earned a master's degree in public administration from the University of Maiduguri, a diploma in neonatology from the Sakla Faculty of Medicine, Tel Aviv University, Israel, in addition to several professional courses which he participated over the years. Professor Jalo has served with the Bauchi State Government as medical officer in Gombe and Bajoga General Hospitals, the University of Maiduguri Teaching Hospital, the Federal Teaching Hospital Gombe, as well as the London Hospital Kuwait in the Middle East. He is presently with the Gombe State University. Through the span of this time, he occupied different positions as a chief resident, head of pediatrics department, dean of clinical sciences, College of Medical Sciences, and is presently a professor of pediatrics. He has equally served as examiner at the undergraduate and postgraduate levels, in addition to being an external examiner to the University of Maiduguri, University of Jos, and Ahmed Bello University, Zaria. As a pediatrician whose dedication to advancing the field of pediatrics has earned him recognition as a leading expert and an inspiration to his peers and students, he has acquired additional certification in courses such as the Essential Newborn Care course, Vaccinology course, and training on critical newborn care. As an academic of repute, he has been involved in training of resident doctors, house officers, and medical students. This covers teaching, conducting researches, and supervision of fellowship dissertations. He has also mentored medical students from the University of New Mexico Medical School, United States of America, among others. Professor Iliya Jalo is a dedicated educator and mentor. He has trained countless young doctors and researchers, instilling in them the values of compassion, curiosity, and excellence. His passion for improving child health outcomes led to groundbreaking research in the areas of tackling pneumonia in children, advancement in the care of neonates, where he made significant contributions to both clinical practice and policy development. Over the years, Professor Iliya Jalo has published over 55 peer-reviewed papers in local and international journals. and his work has been pivotal in shaping adaptive measures for the survival of neonates in northeast Nigeria. The researches not only reflect academic rigor, but also demonstrate a commitment to addressing the real-world challenges faced by children, families, and healthcare systems globally. His leadership role has reflected in his work as head of Pediatrics Department, President Association of Resident Doctors, University of Maiduguri Teaching Hospital, Assistant Secretary, Nigerian Medical Association, Chairman, NMA Committees on both Ethics and Lobby, Chair, Nigerian Medical Association, Gombe State, among many others. He is currently the accreditation representative, Faculty of Pediatrics, West African College of Physicians, and this exemplifies his ability to bridge clinical care, research, and education seamlessly. Professor Iliya Jalo is a quintessential member of a number of professional bodies, such as the NMA, Pediatric Association of Nigeria, International Pediatrics Association, Nigerian Society of Neonatal Medicine, to mention but a few for want of time. He has offered his services in advocacy and many community service engagements as either chair or member of ad hoc committees. He was the chairman of committees such as Research and Ethics, Clinical Meeting and Laboratory Revolving Fund in the defunct FMC Gombe. Top among his other engagements was when he served as chair, local organizing committee during the West African College of Physicians National Conference, which held in Gombe in 2016. An LOC chair at the recently concluded Pediatrics Association of Nigeria Conference, which was hosted here in Gombe from the 22nd to the 25th of January 2025, just recently. He has served as the chair of Tula community in Maiduguri, Borno State. I was the pioneer chairman of Tula Youth Vanguard. His continued service to the community earned him the title of Masanin Tula. And this availed him the opportunity to keep offering his untiring support to the Tula Traditional Council till date. Professor Iliya Jalo has also participated in a number of health interventionist programs in his immediate and extended community. To mention but a few, he was the member of the National Health Committee to the Holy Land of Israel in 2009, as well as the chair, Medical Outreach, in 2023 and 2024 in Tula community. Professor Iliya Jalo is happily married to Dr. Iliya Jalo and are blessed with 4 children. Today, we in this university celebrate not only his remarkable achievement, but also his vision for the future of pediatrics. As he delivers this inaugural lecture, we are reminded of his unwavering commitment to improving the life of children everywhere. Ladies and gentlemen, on behalf of the Vice-Chancellor, please join me in welcoming Professor Iliya Jalo to the podium for his inaugural speech.
The Acting Vice-Chancellor, Professor Sani Ahmed Yauta, the Deputy Vice-Chancellor, the University Registrar, the University Librarian, Dr. HJRY Minor, the Bursar, Chief Zapania Shehu, the Chief Medical Director, Federal Teaching Hospital Gombe, the Provost, College of Medical Sciences, Gombe State University, Deans, Provosts, and Directors here present, professors and members of the Senate, permit me to specially recognize the Maitula, His Royal Highness, Alhaji Abubakar Atere Bubat II, who personally came to my residence to tell me that he will not be available, but will be represented by his dear wife, Hajia Mariam Buba Ateri. My dear wife, Dr. Iliya Jalo, invited guests, dear students, gentlemen of the press, ladies and gentlemen, good evening. Mr. Vice-Chancellor, sir, I count it a rare honor and privilege for this opportunity to deliver this address to this esteemed audience. My inaugural lecture is considered seminal in several ways. It is the first from the Department of Pediatrics, Faculty of Medical Sciences, Gombe State University. It is also the first from my chiefdom and the first from my local government. And indeed, to the best of my knowledge, the first by an indigene of Gombe State in this revered field of neonatology. The opportunity to deliver an inaugural will be counted by so many people in so many different ways. For others, it's sheer luck. For others, it's hard work. For others, it's destiny. But for myself, I consider this rare opportunity a miracle. For you to understand why it is a miracle, I will take you down memory lane for a short while. About 62 years ago, a woman was in labor in a village in Bule community of Wangetula. She labored all day and all night and hadn't been delivered of her baby. Her husband, Baba Jalo, was worried for the plight of his wife. He then sent word to his brother, Mr. Sukuku, who was an evangelist, to come to their aid. On arrival of the evangelist, the woman delivered. And the evangelist said, "Lo and behold, do not worry. Iliya is here. He shall be a great man." The boy Iliya continued to grow in the village. And at the age of 4, started following his father to the farm. At a time when using the plow and the bulls was the most popular way of farming. Therefore, my first profession was to take care of the cows after their walk in the morning from 6 to 11. The young Iliya will proudly take his cows, mix it with those of the Fulani nobles around our area, and start his day until late in the evening, when he will retire and pull off his cloak and retire home. At the age of 7, I had mastered the art of using the bulls to plow. And with a father who had a relative average of 5 bulls each time, I was set to become the next village champion. Until the evangelists intervened by enrolling me into primary school. Consequently, I started my primary school. And I considered my education, in brief, I would say it's a journey of twos. 2 primary schools different attended, 2 secondary schools attended, 2 universities attended, 2 different degrees conferred, and I now work for 2 different institutions. So, in the past 35 years of my practice, I have interacted with so many people, especially in the Northeast. When I was the main pediatrician visiting and training young doctors in many schools and hospitals in the Northeast. This explains why such an important engagement like an inaugural lecture, which should come at the middle of the academic shelf life of an individual, is coming at the twilight of my career. At this point, Mr. Vice-Chancellor, sir, ladies and gentlemen, I thank the management of the State University for giving me the platform to explore and express my academic potentials that culminated in the opportunity to deliver the 14th Inaugural Lecture of this esteemed institution. Some of us here will ask, what is pediatrics? Pediatrics emerged over a century ago in response to the fact that we realize that the needs of the child is different from that of the adult. And that even among children, the response to disease and stress differ with the stage of growth and development of the child. Therefore, pediatricians take care of the well-being of the child, and these include their physical, mental, social, and even spiritual well-being. The pediatrician deals with routine diseases of the child, prevention of possible diseases, complex and interactive diseases, and above all, the pediatrician is an advocate. We now look at what are the factors that attract young doctors to a career in pediatrics. This is a study that revealed that among interns that finish their internship in an institution, female, when you look at it by gender, female are more inclined to take to pediatrics than male. And among the factors that attract these young doctors to pediatrics include the fact that pediatrics is that subject that requires a lot of intellectual challenge. Pediatrics, there are also people who take to pediatrics because of their role models. specialist became a pediatrician? Simply two factors. As an undergraduate student in the procedures Ahmed University, I had an encounter with the legendary Professor Al-Hassan Mela Yakub during our junior person in pediatrics. The professor came into the ward in the evening around 5 p.m. for routine supervision. He met a woman going out at the exit and he carrying a bulletin bag. He asked the woman, "Lady, what are you carrying?" "These are drugs prescribed for me by the doctor." The professor then called back the woman, took all the medications, and asked the doctor that prescribed all these 5 to 7 medications to take 5 meals each of the drug. And the doctor took. And the professor said, now, how do you feel? From that time, the professor sat down. You can see him here, sorry, this pointer is not. The professor sat down and gave us an extensive intellectual discourse on the need to use drugs to treat disease and not symptoms, and also for the bad effects of taking so many drugs at the same time, called polypharmacy. In this picture, you can see young Iliya there looking at the professor. Right down. And at the end of this discussion, young Iliya had made up his mind to become like this intellectual professor. So therefore, from their effort, I made up my mind. And when it was time to start residency in Maiduguri, I had no doubt on what to do. Then, why I focus on neonatology? Neonatology is a rapidly expanding field, and it focuses on the care of children within the first 28 days of life. And we can see that in the tropics, newborn health is grossly neglected, such that even in some cultures, newborns are not named until after the neonatal period because they are at high risk of dying. So therefore, I felt as a young doctor, giving my own contributions to neonatology is very apt at this time. So this slide shows us the causes of newborn deaths. Mr. Vice-Chancellor, ladies and gentlemen, my lecture is an attempt. Thank you. My lecture is an attempt to share my cumulative experience for 35 years of teaching, practice of medicine, pediatrics, and neonatology. So, I will take my presentation in these thematic areas. As a young trainee at the University of Maiduguri, when I started the program, and I realized shortly that I was the only resident in the department, and that the hospital was not even accredited for residency training. So therefore, I had the challenge of either leaving the place or becoming the guinea pig. I mustered courage to become the guinea pig. So without an immediate senior, it was just the interface between me and my consultants. And as somebody who is skilled in research and the practice of pediatrics, I stuck closely to my consultants, leading to the following publications as a resident. And so therefore, at the end of my residency program, I had already six publications to my name, and I was ready to grasp an opportunity in the University of Maiduguri to further my academic program. However, the trajectory changed once more when we were contacted by the then medical director, the pioneer medical director of Federal Teaching Hospital in Gombe, Dr. Ali Gombe, to come and help build a state-of-the-art hospital which Gombe people will be proud of. I had to sacrifice my academic ambition, come back to Gombe to help build the Federal Medical Center that stands today as a testimony of the legacy and our pioneering efforts. While in the Federal Medical Center Gombe, we were invited by the Federal Ministry of Health to be trained in 2005 as the core first batch of consultants in a national facilitators for case management of malaria. And that training further set the stage for my involvement in training of health workers across the Northeast. This training includes, but not limited to, Damaturu in 2005, Gombe in 2007, Jalingo 2008, and Bauchi 2008. With this, we were further given the assignment of a national research that documents the adverse events following administration of the new anti-malaria that was adopted at that time. At that time, chloroquine and fansidar was the primary first-line drugs for treatment of uncomplicated malaria. So, with the inception of the artemisinin-based combinations, we were commissioned by the Federal Ministry of Health to nationwide document the adverse side effects following administration of the artemisinin-based combination, which we did. The summary of the findings are that there are some morbidities such as hypertension and diabetes, pregnancy, and even in children that have the potential of developing side effects with the use of artemisinin-based combination. However, the recommendation is that globally, artemisinin-based combination are safe and the side effects profile are tolerable. That is how the federal government, through NAFDAC, introduced the artemisinin-based combination as first-line therapy for research in pneumonia. My initial attempt at documenting pneumonia burden in Federal Teaching Hospital showed that 50% of patients presenting to the pediatrics department with community-acquired pneumonia children over a year. That we looked at burden presenting to pneumonia to Federal Teaching Hospital for 20 years. So we did a
retrospective analysis of a 20-year burden of pneumonia, and that showed that the case fatality for this disease is 9.3. To direct further on one of the studies that we were involved in pneumonia, this was also a national study. We looked at the impact of pneumococcal conjugate vaccine 10 that was introduced in the immunization schedule of Nigeria. Before then, there was no clear documentation of the national impact of the immunization. So, with a center in Federal Teaching Hospital, the other one in National Hospital Abuja, and the other one in University College Hospital Ibadan, we looked at pneumonia hospitalization and mortality in children aged 3 months to 4 months. 3 years before the introduction of vaccine, and 3 years after the introduction of vaccine, to see what the impact was. The results show that with the introduction of the vaccine, the total pneumonia burden reduced, and even the death rate from pneumonia in this age group also reduced. And this is one such study that is the first in documenting the impact of the pneumococcal conjugate vaccine that was introduced into our immunization scheme. Vice-Chancellor, sir, ladies and gentlemen, I want to look further and examine my topic, the dilemma of the neonatologist in low-resource setting, using improvised technologies to enhance newborn survival. One of the key strategies for newborn survival is this. And I have been trained as certified trainers by UNICEF that assess health facilities for designation as baby-friendly hospitals. This assignment took me to all the nooks and crannies of this country. Again, as a certified master trainer in lactation management, I obtained a grant from UNICEF that I used to train 2 batches of health workers from the State Ministry of Health and the Federal Medical Center on lactation management and exclusive breastfeeding. This, no doubt, impacted positively in the survival of children in our area. Then in 2009, as the consultant to Federal Ministry of Health, we had a situation analysis, a desktop review of this review took me to the 3 senatorial zones, and at the end of the day, these were the common causes of mortality in under 5 and pregnant women in labor and delivery. However, one of the key findings of this research was that neonatal mortality was not recorded in Gombe State. When we asked at the health facility, we've seen women dying, we've seen children dying. What of the newborn? What happens to them? They say, doctor, we just give it to their parents to go and bury. So from there, we recommended that newborn records be incorporated into all hospital health statistics. This was This was sorry, it's not moving. It's moving by itself. Right. Okay. No, it's moving by itself. Sorry. It's a technical. So this was part of a study that all states of all 36 states of the Federation and FCT was involved in. And this led to the involvement of in okay. The next is preterm. Okay. Yeah. Okay. Yeah. No. No. Okay. So I think we can go on. The next one is how to care for the preterm. Preterm care is one such challenging area because preterm births in many countries, in developing countries, almost all babies born before 32 weeks survive. And that reminds me when I was training in neonatology in Wilson Hospital in Israel. For the whole period that I trained in the hospital, there was only one patient, newborn patient, that died for the whole period. And that was a baby born at 26 weeks who had spontaneous perforation, and the surgery was done right there in the incubator. But that was the only patient that died. But in our community, what are the challenges? What challenges do we have with preterm here? Because of absence of the facilities like the incubators that we use for newborn care, we have to improvise by what we call kangaroo mother care. The kangaroo mother care is a situation where the baby is trapped in mother's chest, skin to skin, such that there is thermal synchrony between the baby and the mother. And there are other advantages are that the baby is close to the breast and is able to suck, and therefore nutrition is not a problem. There is reduced risk of infection. There is also the fact that the mother is carrying the baby and looking at the baby directly. There is this bonding between the mother and the baby, and this engenders the mother's confidence in the care of the baby. This overall increases the chances of survival of preterm babies in low
resource setting. Our research on perinatal asphyxia. Asphyxia is the situation where newborn babies do not cry immediately after birth and do not establish breathing. Therefore, if babies do not cry immediately after birth, just as Iliya did 62 years ago, they stand the chance of having injury to the brain and other organs. So, magnesium sulfate, which is already established as a neuroprotective agent in protecting the newborn brain after asphyxial injury, but it's not the neuroprotective aspect. But we have been receiving patients from referral centers after 8 hours, after 10 hours, after 24 hours. It is shown that magnesium sulfate has maximum effect when given in the active therapeutic window before 6 hours. But the objective of our study was to look at the different timings of administration of the first dose of magnesium sulfate, whether it had an effect on newborn survival and mortality. Our findings show that newborns who are given magnesium, irrespective of the timing of the first dose, had teaching hospital Gombe. We reviewed we had a 10-year review of congenital malformations in Federal Teaching Hospital Gombe. At the end of the review, it was found out that neural tube defects and gastrointestinal abnormalities form the main thrust of the number of congenital malformations. Even though it is already documented that folic acid given to women pre-conception help in preventing neural tube defect. Our findings show that all the women that had antenatal care and therefore were given folic acid started the antenatal at 20 weeks and above. Unfortunately, before the end of the first month of intrauterine development, the neural tube has been formed. Therefore, the challenge here is that we have to prevent neural tube defect. Challenges of asking a woman who is well and about and has not even taken in to start medications every day, especially those who are preterm. Therefore, it is important to have the facility to be able to attend to the patient and manage the respiratory distress while treating the primary cause of the respiratory distress. In high-income settings, they have incubators, they have various machines, but in our own clients, we have challenges with supply of respiratory machines that can take care of respiration in the newborn. Then an expiratory limb, then connected to a source that will deliver the pressure. Therefore, what we do is to use oxygen directly from the cylinder, pass it through a humidifier, then to the baby. And what we do is to connect the tube to a bottle like this with graduation marks. And then we know that the length of the tube inside the water now represents the pressure that the baby has to breathe against. And with that, many babies were saved because as the baby breathes against the pressure, the lungs of the baby expand, the alveoli open, it prevents the lungs of the baby to collapse while the baby breathes out. So with this improvised technique, we were able to manage so many babies with respiratory distress. Ladies and gentlemen, this improvised setting we have been using in our unit for over 15 years. But I'm glad to announce that at the last concluded Pediatric Association of Nigerian Conference that held here in Gombe, there were over 200 health workers that had various courses that build the capacity of health workers for care of newborn, in lactation management, respiratory support, and others. Again, I'm glad to also announce that in our midst are experts from Benin and other areas, which include my own teacher in the postgraduate training, who are now in Gombe, empowering and building capacity of health workers in aspects of respiratory support. Mr. Vice-Chancellor, sir, ladies and gentlemen, with the kind permission of the Vice-Chancellor, I want to recognize my teacher who took our time all the way from Benin to come to give us this detailed in Gombe, Professor A.A. Okolo. Thank you very much, ma'am. My next presentation is on teaching and mentorship, security challenges. With our coming to Federal Teaching Hospital Gombe, I was the only consultant then in the department. And I knew that yes, if this place has to develop, the stress rests squarely on my shoulders. And when Professor Isaac joined us, we had to ask our teachers, Professor Esen Okolo, Professor Bode Thomas from Jos University Teaching Hospital, and Professor Olufemi Ogurunde from Ahmed Bello University to join us as visiting lecturers so that we will be able to have accreditation to train resident doctors in pediatrics. Mr. Vice-Chancellor, sir, ladies and gentlemen, I want to proudly announce that from this humble beginning, I have been able to supervise and train 22 consultants in Federal Medical Center Gombe. Expectedly, but regrettably, most of them have jabbered out. But not to worry, the machine that synthesized them is still around. Having spent so many years in Federal Medical Center and risen to the last bar of chief consultant, I therefore was invited to join co-academics to give life to the newly established Faculty of Clinical Sciences, Gombe State University. It was not an easy decision to make as it entails one, taking a lower position of a senior lecturer as opposed to my then rank of a chief consultant. 2, leaving federal service for state service. And 3, having a salary differential of over 200,000. The bossa knows very well about this. I had to painfully take that decision for the sake of Gombe State and for the sake of our children. I was glad when finally, as serving as Dean of Clinical Sciences, the whole world witnessed the graduation of the first batch of medical students. Mr. Vice-Chancellor, sir, ladies and gentlemen, conclusions. Neonatal mortality rate is still, in resource setting, is still very high. There exist considerable gaps in neonatal services, rising from lack of equipment and the fact that we have to use improvised technologies to serve. Can I have the next slide? Can we run through the slides now? Is it possible? Can we run through the slides quickly? Recommendation by government, recommendation. Okay, let me take this one. Pediatric Association of Nigeria, we've already said that they are doing exceedingly well by training other health workers in various fields. And the Neonatal Society of Nigeria too, they are doing well by encouraging the establishment of centers for training of neonatal nurses. So, I wish, Mr. Vice-Chancellor, sir, ladies and gentlemen, let me acknowledge some few people that were very instrumental in my growth and development as a medical doctor. I wish to appreciate my immediate family, my parents, my late parents, who spared nothing are getting us educated and inculcating in us good and sound moral values. Let me also acknowledge and appreciate my teachers during the undergraduate level, Professor Alhassan Yakubu and Professor William Ogala, who is a renowned neonatologist and incidentally was my supervisor at the fellowship level. I will also want to acknowledge our teachers in Jos University Teaching Hospital, led by the indefatigable Professor A.A. Okolo, who is here, and Professor S.N. Okolo, Professor Stephen Oguche, and Dr. Ibohoja. They played a very critical role in my foundation. At the University of Maiduguri, I recognize Professor Akpede, Professor Airede, Professor Rabasa, Professor Ambe, and Professor Roger Sykes, who were my teachers that laid the strong foundation for my postgraduate education. I owe gratitude to my friends, colleagues at various levels. Ladies and gentlemen, with or without pictures, I have to recognize the bone of my bones and the flesh of my flesh. The director and chief advisor for our love, patience, and my dear wife, Dr. Iliya
Iliya Jalo.
Finally, sir, I know my uncle is looking down from heaven with satisfaction and a smile, saying that my declaration on day one that he shall be a great man has been fulfilled. Thank you very much.
Distinguished ladies, may we rise for an ovation. Thank you very much, Prof. Thank you. Please a round of applause as he takes his seat. Thank you very much. We may kindly take our seats. Thank you very much. Mr. Vice-Chancellor, sir, distinguished ladies and gentlemen, please, as a committee and as a university, we apologize for this technical hitch-up. We assure you that this will not happen again. Our sincere apologies. Want to recognize again, having done that by the guest inaugural lecturer himself, rather, we recognize the presence of Professor A.A. Okolo. You're very much welcome, Mark, and we welcome you to Gombe State University. Distinguished ladies and gentlemen, I want to invite for the vote of thanks, Professor Muhammad Manga, the Provost, College of Medical Sciences, Gombe State University, shall come for the vote of thanks. You're welcome, sir.
Thank you very much, Mr. Vice-Chancellor, sir. Permit me to stand on established protocols. I can now say, lo and behold, Iliya has delivered. So we sincerely start by appreciating our inaugural lecturer for today, for all the efforts. I can say that Professor Jalo is among the brave elders that actually took the courage to join the university at an age that really is very difficult to take such a decision. And not only that, taking the courage and the pain to go through the rigors of assessments from reader to becoming a professor after being appointed as a senior lecturer. And we appreciate you for all this, and we hope that this kind of inspirations we get from our elders will continue to get many more. We want to appreciate Professor Okolo for being with the hospital and now being with the university, for being a friend of Gombe. We sincerely appreciate your patience and support all through the years, right from the days of late Dr. Yahya Al-Ghali in pediatrics. I think this name is very prominent in the pediatric space. We particularly appreciate the entire department, and this is one department that will treat in milligrams and punish in kilograms. That is what we were told when we went to the Department of Pediatrics. Welcome to the Department of Pediatrics, where we treat in milligrams but punish in kilograms. And I think it's very clear the reason why they have to punish in kilograms, because the mistakes in pediatrics are things that are not tolerated when you compare to what we have in the adult medicine. The Vice-Chancellor, sir, it's very clear now that our series of inaugural lectures have become constant, and both the university management, the committee have really done very well in ensuring and sustaining this legacy. And we sincerely appreciate the university management for all these efforts and hope and pray that this gesture will continue. For the committee under the leadership of our father, Professor Gurama, the system now has been built, even though we're a bit embarrassed with the technical failure, which is not something that is still unexpected, but I think it has become almost automatic that month after month we know who is presenting next. And this is one effort that will sincerely be appreciated. For everybody who has put in directly or indirectly in making sure that this day is successful is sincerely appreciated, and we hope and pray that the Almighty will continue and reward all these efforts and that the successes will be sustained. Thank you very much, and God bless.
Thank you very much, Mr. Vice-Chancellor, sir. The agenda for today's event is over, and at this moment, with your permission, I will call that we rise to our feet for the national anthem. Well, please, immediately after the national anthem, invited guests, we crave your indulgence